GPs have been really concerned that list cleaning disproportionately affects groups that are already experiencing health inequalities. And your investigation this week found that that is actually borne out by the data, hasn't it?
Yeah, so right from the start, a few months back when we first noticed the drop in registered patients, GPs said that the patients most likely to be removed from practice lists were going to be those who don't have English as a first language, those in insecure or shared accommodation where they're maybe less likely to get post reliably, people who don't necessarily have access to a phone or a phone all the time or a phone that works well, and essentially patients in deprived areas often. Over the first half of this year, NHS England published data on the number of patients registered in these small geographical areas of the country called lower super output areas, or LSOAs. Practices generally have patients registered in multiple LSOAs. There are probably 34,000 LSOAs, and there are 6,000 practices. Obviously, practices serve patients in different areas. And I combined data on levels of deprivation in each LSOA with the change in registered patients, and found that the drop in registered patients has been heavily skewed towards deprived areas. So very much, as you say, bearing out the concerns that GPs have had from the outset. Roughly 3 times as many patients were removed in the most deprived 10% of the country compared with the least deprived 10%. Of around 450,000 patients removed in total over the period I could look at, like I say, the data was only from January to July, half were in the most deprived third of LSOAs. So again, the data show really clearly that deprived areas have been hit far harder by list cleaning.